Hi, my name is Adam Gepner. I'm a cardiovascular medicine fellow from the University of Wisconsin, and I'll be talking about my research today, which is looking at ECG changes and ECG abnormalities in smoking and smoking cessation outcomes from a randomized controlled trial. In this study, we were evaluating 5 different smoking cessation pharmacotherapies, and people were randomized to those trials. At baseline, everybody had a resting 12-lead ECG, and we were interested in finding out if smoking burden at baseline was associated with ECG abnormalities, and also if you quit smoking, whether or not your ECG abnormalities went away. So we followed these folks for 3 years, and after 3 years got a repeat ECG. Our major finding in our multivariable regression analyses was that people who smoking burden at baseline was actually associated with major ECG abnormalities, but we didn't see that with current smoking per day. So really, pack years, how much you smoked over how long, was the biggest association. We didn't see any differences between minor ECG abnormalities and smoking burden, which may also be expected since it's a little bit less specific in terms of those. The next thing that I would like to point out is that among smokers and those who quit at year 3, there was some subtle differences. People who quit smoking actually gained about a kilogram more weight than those who continued smoking, and also at year 3, among all subjects, there was about a significant increase in the number of people on antihypertensive therapy and also on lipid-lowering therapy. So at baseline, about 5% were on those medicines, whereas about 20% were on those medicines at follow-up. So so while we didn't see any differences between ECG abnormalities at baseline and ECG abnormalities at year 3 among quitting and not quitting, they were relatively the same. There were some attenuating factors, namely treatment of traditional cardiovascular disease risk and also weight gain in those who abstained. The next step of this study is to continue it. We've got funding for another 5 years, and we're going to have these people back and also adjudicate hard cardiovascular disease outcomes to see if smoking cessation and ECG changes are actually associated with hard events. So the continued smokers, we didn't see a regression or any new ECG abnormalities. We also saw that there was a lot more people being treated for traditional ECG risk factors, and so that could have attenuated the results. So really, smoking burden is the only thing that we found was associated. Smoking burden at baseline was the only thing that we found that was significantly associated with smoking, with ECG abnormalities. The major ECG abnormalities include things like major Q waves, which are markers of old myocardial infarctions, left and right bundle branch block, and really epidemiologic studies have traditionally lumped these together just because the numbers are otherwise too few to make any real interpretation of those data amongst themselves.